I wish more people hear this before it's too late. One of the most common things patients say to me is, Doctor, another surgeon already told me I need surgery, but something doesn't feel right. That patient is not confused. They are not difficult patient. They are standing in the middle of a system that quietly pushes toward surgery. If you were told this is normal, it's nothing, or you'll need surgery eventually anyway, this is for you. So let me start with the main problem. Many surgery are done not because they are clearly required, but because everything around the decision pushes that direction. The system rewards action. Inaction is harder to defend. And this is the clear truth surgery can be. Within guidelines, technically correct, done with good intent, and still be clinically unnecessary. In surgery, the hardest decision is often not operating. So you would ask why people misunderstand this. Patients often think if imaging shows something, it must be fixed. If pain exists, surgery is the solution. If a surgeon hesitates, they are being dismissive. But the reality is more uncomfortable. Let me tell you about the missing reality, the system pressure. Here's what most patients never hear. In modern healthcare, a surgeon can be punished more easily for not operating than for operating. If a surgeon follows a strict indication and says, let's wait, three things can happen. Number one, the patient gets stressed and seeks another opinion and often ends up having surgery elsewhere anyway. Number two, if something changes later, it's far easier to blame the surgeon who did not operate than the one who did. Three, metrics, reviews, productivity, and institutional pressure quietly reward intervention over restraint. Operating is defensible. Waiting requires explanation, time, and trust. And here comes the patient push, rarely discussed. Sometimes the push for surgery doesn't come from the system, it comes from the patient. Fear, pain and tolerance, a story from friends, Google search. Holding a patient back from unnecessary surgery takes more effort than scheduling it. And not every system gives surgeon the time or support to do that. This is what actually happened in real life. Small hernia, tiny, safe to watch. Patient fears strangulation. Stress builds. Surgery happens, not because risk was high, but because reassurance failed. Gallbladder, after something, one episode, not sure, one vague pain episode, stone on the ultrasound. Patient fears emergency surgery later. Elective surgery happens, even though many never recur. The benign thyroid nodule. On the biopsy, it's benign. No symptoms. Patient fears cancer anyway. Thyroid removed, lifetime medication follows. Diverticulitis, one controlled episode. People are looking at old guidelines that still linger there. Patient fears rupture, surgery chosen for peace of mind, not necessity. So the pattern is in all these cases, surgery was allowed, the surgeon followed rules, consent was real, but the indication was weak, and the pressure was strong. As a surgeon, we are trained to operate, but to restrain, especially under pressure, is one of the hardest skills to develop. Sometimes the most ethical decision is also the least protected one. This is my bottom line here. Some surgeries are absolutely life-saving and time-sensitive. Delaying them causes harm. This message is not anti-surgery. It's a pro-indication. Nothing should be assumed by the patient or by the surgeons. And if you remember something from this talk, remember this. Before agreeing to surgery, ask 3 questions. What happens if I wait? What specific risk am I avoiding by operating now? And 3, if I choose observation, what would trigger surgery later? If those answers are not clear, you don't need pressure, you need clarity. This is Dr. Ben Mommer. Hit follow to build up momentum to fix healthcare in America. And please let me know what you think, because your feedback helped me sharpen the message.